Hi guys, welcome back to my channel. Today, what I'm gonna share on my diary is about the task of a night shift nurse working in a long-term care facility, because I just wanna, share insights of what are the things that I do. This is, of course, for those nurses who are coming here in the near future and will also be placed in a long-term care facility, so that you will have like an idea of what are the things that you do when you are working on a night shift. So I listed it down and let's start. All right, so first thing that is on my checklist: to receive report from the outgoing nurse. So we usually has a report sheet paper. So for our residents, since I am working in a long-term care facility, it is composed of minimum is 30 residents. That is, I'm talking about one nursing station. So the minimum is 30 residents, and the maximum would be around 48. I think that's the max residents that I handled, 48 in one nursing station. So then after you receive the report, they are very concise here when they give report, just the latest update of the resident, because you have a lot of residents, so you cannot you cannot also give too much detail for a report. Just what happened for that day, or what are any update, or a new order from the doctor, so, or what happened to, if there's something happened to the resident. So that's the only thing that they mentioned during the report. And the report only lasts, the report takes around 5 to 10 minutes, sometimes 15, if there's a lot of things going on. So that's about it for the first checklist report. So after that, of course, you're gonna prepare now for the things that you need for your medication pass. So again, for the night shifters, there is what you call a bedtime pass, or the medications before their bedtime. So that's the major med pass that I do during night shift, and that's and I allot time for my med pass from 6:30 in the evening up to around 8:30 or 9 p.m. That's about it. For the med pass, there are different kinds of medications that we give, but 90% of the time we usually give oral medicine. So it's very much easier compared to a hospital setting, because I know in the hospital setting it's more on IV medications or subcutaneous medications, but in a long-term care facility setting, it's more on oral meds. And of course, we do also give insulin shots. So it's either insulin that's like a pen, a quick pen, or using a syringe, so a subcutaneous injection. And what else? For the medication pass, we also give medications through tube feeding. So we do have residents that has feeding. So usually for the G tube feeding, we usually give it a bolus feeding, or through we use also the infusion pump if it is a continuous kind of feeding. So that's I think the kind of medication that is time consuming, the tube feeding. So I usually do it last. What else? IV antibiotics. Yes, we do also give medicine through IV, and but this is very seldom. So when a resident was hospitalized, and then the resident will receive IV antibiotic when the resident comes back to the long-term care facility. So they usually already has a peak line, and that's where we give IV antibiotics. It's not usually the one that is in the hospital that's like IV with the IV pole or something like that. It's very just like a compact IV bulb that, you know, it has the antibiotic in it, and it will only run like 30 to 40 minutes, or it depends on the medication, but it is only, like, you know, placed on an IV, on a PIC line. And also we also give IM injections who receives antibiotics through IM. So there. So oral, subcutaneous, IM, IV, and feeding tube through tubes. There you go. So those are the types of medicines that we give in LTC. The next one is for the wound treatment. We do wound dressings for the different types of wounds of our residents, but most commonly are pressure ulcers and, you know, cellulitis. There you go. And I'm just gonna also mention about what are the usual procedures that we do in a long-term care setting. So the most or the basic procedures would be the catheter insertion. So we do have residents that requires you know, catheters. So they have like a monthly change for their catheter. So basically that's it. Or sometimes we also have residents that requires, you know, bladder scan. So we do bladder scanning, we do catheter insertion, and we also do just urine or stool specimen collection, because during night shift, that's the time that we need to collect the specimen, because the laboratory comes in early morning and collects the specimen. So we don't have, in our facility, we don't have an in-house lab. So it's like a third party. So the laboratory personnel will come in very early in the morning to draw blood from the resident or collect the specimen. It's either urine or stool, whatever it is, or sputum. So there, basically that's it. At the same time, you know, during medication pass, there are also residents that has you know, being monitored like clinically. So we call it CM, or clinical monitoring. So like any resident who receives an antibiotic needs to be like charted with clinical monitoring, or CM, because of the possible adverse effects having that antibiotic. So clinical monitoring is like, for example, if the resident has an infection for UTI, so the resident will be, you know, given an antibiotic to treat her UTI. So if that's the case of the resident, then of course, aside from the vital signs, you also need to take note of if the resident has a catheter, or if the resident is continent or incontinent, and like with the color of the urine. So anything that is related about the urinary system, that's it. And if the resident has a problem of respiratory, then of course you have to also take note of the signs and symptoms of the patients on the breathing, or, you know, that if the person has a cough or wheezing sound or whatever, lung sounds. So there, you just have to align the assessment that you want to do to the resident. So we also have residents that are skilled. So skilled residents we usually also chart like what is being skilled for the patient. So for example, if the patient had a fall, or if a patient had a stroke, so you have to like monitor symptoms for stroke, what are the things that you need to watch out for, and what are the interventions that you need to do if you have a resident like that. And of course, your vital signs, your assessment, evaluation, like things like that. So that also, like, you know, eat up, you know, the time. It also consumes the time. So That's it for vital signs and assessments, for clinical monitoring, and for those who are skilled. All right. So after that, what I'm gonna do, if I'm all done with my beds, with treatments, with procedures, that's the time that I'm gonna sit on my computer and start on my documentation or charting. So what are the things that we document or we chart? We do have a hot chart. It's like a daily. We update that on a daily basis to, to reflect who are the residents that needs to be charted on. So what's good about LTC or long-term care is that not all residents needs to be charted. It's only those who are listed on the hot chart or hot charting. So those who are being monitored clinically, those who are skilled, those who has medication changes, and those who had an emergency or had a fall, and those who are constipated. So basically, those are the things that we list down, and it's the night shift nurse who updates the hot chart list on a daily basis. So I do that, and then so that is between. I usually do my charting from, like, if I'm done like for 10 p.m. So between 10 p.m. to 11 p.m. that's where I do my charting. And then at 11 p.m. I'm gonna start already to give medication pass again. So those residents with the scheduled medicine for 12 midnight, I usually give it at 11 p.m. And then right after I'm done with the medications for the midnight, I take my lunch. So usually we have 30-minute lunch, and it is not paid. So we have to, to really use the time for lunch. So I usually just really go to the break room and take my lunch for 30 minutes because it's not paid. There. And then after that, so after that, like around midnight, so I will be back at my desk at around midnight. And then the next thing that I need to do as the night shift nurse is to print out the midnight census. So daily we have to update the census for the day, because we need to submit that to the admin. Like we have, because sometimes if there is a resident that was sent out to the hospital, or if there is a resident that is still in the hospital, and then they will not be counted on the census. So that's why we need to update it on a daily basis. And then aside from the census, we are also responsible on printing out the labs that are due in the morning. So if today is Monday, then we have to print out labs that is due for Tuesday morning. There. So that's part of our that's part of my task as a night shift nurse. After that, this is the best part. so from 12 midnight, once I'm done printing the midnight census, because it only like takes less than 5 minutes to do this task. After that, it's downtime. So from 12 midnight up until 4 o'clock in the morning, it's downtime for the night shift nurse. And at 4 o'clock, I already preparing for the things that they need for the morning. What are those things that they need? So prepare for the water, the pitcher. We have to fill it with water and ice, and then we also have to refill or to fill in the medicine cups, the water, the cups for the water, the straw. What else? The spoons that they need. There are also, residents that need boost, or like it's a juice or something that they call it boost, but it's like it's like a juice, like for supplement. And as well as there are residents that needs their medications to be crushed. So we also prepare for pudding. an applesauce. So we also refill those. And what else? We also get a box for diabetes. So it has the blood sugar check. We have to refill the, you know, the things that you use for insulin refills. And at the same time, we also have to take down, of course, the medicines that needs to be refilled, because it has to be faxed to our pharmacy. So our pharmacy is also not in-house, so we fax it over to the pharmacy, because they deliver medicines only twice a day. So once in the morning, or once during daytime, and another one for around 6 p.m. or right after 6. So twice a day. They deliver medicines for twice a day. That's it. So after that, around 4:30, once I'm all done with all refilling things, at 4:30, I already prepare my medicine for, so there are also like few residents that has medicines for 4 a.m. or 5 a.m. So I usually give my medicines from 4:30 to 5 a.m. And then after that, I'm good to go. Around 5 a.m., I'm just gonna wait until 6 a.m. for my shift to finish. And then at 6 a.m., once my the incoming nurse comes in, I'm gonna give report, and then I'm gonna go home. So I usually go home around 6:15 if I finish my report as early as 6:15, or I'm gonna wait until 6:30 so that I will be paid my 12-hour shift, because we are not paid for our lunch, right? So we need to, we need to wait for at least until 6:30 in the morning before we log out, so that we will be paid. All right, so that's basically it. If you get used to it, it will become easier in time. But if you're just starting, then you will also be, you'll also like struggle a bit, because you have to like manage your time wisely. So I think that's the most important thing that I can, give tips, is time management is really, really important in long-term care, because you have a lot of patients, and you have to give their medicines on time, and you have like a lot of things to do. So that's basically it. Time management is the key, and it's really nice. It's not heavy. The task for a night shift is much like less. It's so much less than the task on a morning shift, because we usually don't do, or we don't usually carry out orders. It's really seldom we carry out orders if like for example, if in the morning shift and there's like a ton of orders that they were not able to finish, they can endorse that to the night shift. So we also carry out orders at night, but that's very, very seldom. So I think that's it, guys. Thank you so much for watching this video, and I hope this can help somebody, give an idea of what's in it in LTC in LTC setup. So all right, I'll see you guys on my next vlog. Thanks for watching. Bye.